It did not begin with explosions. It did not begin with headlines. It began quietly with a cough. In the early days of March 1918, at Camp Funston in Kansas, a massive U.S. Army training facility preparing young soldiers for World War I, one man stepped forward with what seemed like nothing more than a seasonal illness. His name was Albert Gitchell, a camp cook. He complained of fever, body aches, a sore throat, and a pounding headache. Doctors examined him, assumed it was an ordinary flu, and told him to rest. By lunchtime, more than 100 soldiers were reporting identical symptoms. Within days, the number climbed into the hundreds. Within weeks, it was no longer containable. What appeared at first to be a mild respiratory infection was the opening note of one of the deadliest catastrophes in human history, but the world barely noticed. In 1918, humanity was consumed by the Great War. Nations were locked in brutal trench warfare. Newspapers were filled with battlefield reports, casualty numbers, and propaganda. Governments were focused on victory, not viruses. Compared to artillery fire and machine guns, a spreading flu seemed insignificant. This first phase, later called the spring wave, was highly contagious but not especially deadly. Soldiers fell ill, recovered, and returned to duty. Troop ships carried infected men across the Atlantic to Europe. Trains transported them across continents. The illness traveled invisibly, hitching rides with armies. And then, something happened that would shape history in a strange and unfair way. As the virus spread through Britain, France, Germany, and the United States, governments suppressed the news. Wartime censorship blocked reports that might weaken morale. Admitting that troops were being incapacitated by disease was considered dangerous. So the public heard very little. But Spain was neutral. Spain had no wartime censorship. When the virus struck Madrid, even infecting King Alfonso VI, Spanish newspapers reported it openly. They described overwhelmed hospitals, rising infections, and widespread fear. Because Spain was the only country speaking honestly, the world falsely concluded that Spain was the origin. Thus, the name Spanish flu was born, not from science but from transparency. By early summer of 1918, the outbreak seemed to fade. Fevers declined, cases dropped, military leaders relaxed. Many assumed it had been a strange but temporary illness. They were wrong. The virus had not vanished. It had transformed. Somewhere deep in infected lungs, the virus mutated into a far more lethal strain. When it resurfaced in late August 1918, it was no longer mild. It was catastrophic. The second wave began in military ports and trenches. Soldiers who appeared healthy in the morning collapsed by evening. Unlike traditional influenza, which typically killed the elderly and very young, this strain targeted young adults, men and women in the strongest years of their lives. Patients developed severe pneumonia. Their lungs filled rapidly with fluid. Many effectively drowned while lying in hospital beds. Doctors reported seeing patients turn a dark blue from oxygen deprivation, a condition known as cyanosis. Death could arrive within hours. What made this strain especially deadly was the immune system itself. The virus triggered what we now call a cytokine storm, an extreme immune overreaction. The body's defenses attacked infected lung tissue so aggressively that they caused massive internal damage. Ironically, the strongest immune systems sometimes suffered the worst outcomes. By September and October, the virus had spread beyond battlefields into civilian populations. In Philadelphia, despite warnings from medical officials, city leaders held a massive Liberty Loan parade to raise funds for the war. Hundreds of thousands attended. Within 72 hours, hospitals were flooded with patients. Within weeks, thousands were dead. Bodies accumulated faster than they could be buried. Morgues overflowed. Coffins ran out. In some neighborhoods, corpses lay on porches waiting for collection. The sounds of celebration were replaced by the creaking wheels of carts transporting the dead. Cities around the world shut down schools, theaters, churches, and public events. Masks made of gauze were worn widely, though they offered limited protection. Public gatherings were banned, yet the virus moved faster than any government order. Fear spread alongside infection. Families isolated their sick members. Neighbors avoided each other. Healthcare workers worked until exhaustion, and many died themselves. Entire communities fell silent. And then came a moment of tragic irony. On November 11, 1918, the First World War officially ended. Armistice Day celebrations erupted across Europe, America, and beyond. Crowds poured into streets, embracing, shouting, singing. After 4 years of slaughter, peace had finally arrived. But in the midst of jubilation, the virus found fresh opportunity. The mass gatherings fueled a third wave that extended into early 1919. While not always as explosive as the second, it was relentless. It swept into regions the war had barely touched. In Western Samoa, a single infected ship docked at port. Within weeks, nearly 1/4 of the population perished. Entire families disappeared. India suffered devastating losses, an estimated 17 million deaths. Rivers reportedly filled with funeral pyres. Villages were left abandoned. The scale of suffering was apocalyptic. Globally, approximately 1/3 of humanity, about 500 million people, became infected. Death toll estimates vary, but between 25 and 50 million people died. Some modern studies suggest the number may have been even higher. At a time when the world population was far smaller than today, this represented 5% of all human beings alive. In the United States alone, average life expectancy dropped by 12 years in a single year, a demographic shock almost unimaginable. And yet, despite its enormity, the pandemic faded strangely from collective memory. Why? Partly because the world was exhausted. The war had ended. Nations were rebuilding. Political revolutions reshaped Europe. The 1920s ushered in economic change, cultural shifts, and technological advancement. Humanity seemed eager to move forward. Monuments were erected to fallen soldiers. Tombs honored battlefield sacrifice. But there were few memorials for those who died quietly at home, struggling to breathe in overcrowded hospitals. The pandemic became overshadowed, almost forgotten. Scientifically, however, it did not disappear. The 1918 virus belonged to the H1N1 influenza family. Over time, it evolved into less deadly seasonal strains that still circulate today. Its genetic descendants remain part of modern influenza outbreaks. The legacy of 1918 is not just measured in numbers. It reshaped public health systems, influenced medical research, and changed how governments respond to infectious disease. It exposed the fragility of global systems during crisis. It demonstrated how war, censorship, and delayed action can amplify disaster. Most haunting of all is how quietly it began. No dramatic announcement, no visible enemy, just an ordinary cough in a Kansas barracks. From that cough grew a chain reaction that circled the planet, entered cities and villages, crossed oceans and islands, and erased tens of millions of lives within 2 short years. It remains one of the clearest reminders that humanity's dominance over the planet is not absolute. Technology, armies, and empires mean little against a microscopic organism capable of mutation and rapid spread. The 1918 influenza pandemic stands as a warning etched into history, a moment when civilization bent under the weight of something unseen. Millions vanished not in battlefields filled with smoke, but in hospital wards filled with silence. Not with explosions, but with breath fading in the dark. And it all started with a cough.